Dr. Lopez, we think about chiropractors. We think about someone who's, cracking our back. Now, that's the street language, right? I know
Right.
it's called, doing adjustment.
Right.
But that's all we know. So is that a misconception about the profession that you're in?
Well, first of all, thank you for having me here today. And yes, that is definitely the street language that pop your back, crack your back. That because that is the surface level stuff. That's basically advertised on social media. People do that for content because people like to see that stuff.
Okay.
But when I learned that particular craft, I a whole new dimension of learning unfolded for me, and I thought, my gosh, this is so much bigger.
Well, let me ask you this, because, it has to be, even in your schooling, that you all learn more than just back adjustment. So, like, give us the, in a way that, a third, fourth, or fifth grader can understand, like, what was the anatomy of even going to school? Like, what did you all learn?
I remember a conversation I had with my son-in-law when we went swimming one day, and my younger brother's also a medical doctor. He's an anesthesiologist.
Okay.
And then we were talking about going through school, and he said, yeah, I went through dissecting cadavers, doing gross anatomy for 6 months. And I said, yeah, I learned that for 8 months. And my son-in-law was like, why? And I said, many people don't know that we also do cadaver dissections. I dissected 2 cadavers when I was in school.
Really?
We studied the same things that medical doctors study. We just don't study a lot of pharmacology or drugs or toxicology, surgery. We study 2 years of radiology. We study anatomy, physiology. We study neurology. We study microbiology. We had to culture our own bacteria in the lab. We cultured viruses. We went and swiped the handrails, the chairs, different places, and grew them on an agar plate in college to see what kind of bacteria or fungus would show up. We studied public health to find out how, what our water treatment programs are like, or things like that. That like, well, and then we were tested very proficiently on those subjects.
So you're saying the only thing that you all didn't go into, or maybe even went into, is like the pharmacology.
Right, prescribing drugs, because we're a drugless profession. People come to us because they're like, well, I don't want to take prescription drugs anymore. I don't want to go the surgical route. And even some doctors would be like, well, let's get you on conservative care first and see if we could exhaust that possibility before
So when you say conservative care, because again, now let's always, I want to make sure the audience and the viewers understand what you're saying. What is conservative care?
Conservative care could mean change your diet, maybe take a walk in the sunlight, maybe get some exercise, maybe just take a walk, get some movement going, get into that lifestyle, get a good night's sleep, get to bed on time, try to manage your stress. That's very conservative, and a lot of people can alleviate their own stress, their own dis-ease, or their own dysfunction with that approach almost 80% of the time if they just make those changes.
Really? So, you could have took the route of becoming a medical doctor, but why did you choose the route of becoming a doctor of chiropractic?
And I love this question because I've always had this sense of like, wow, what is it like to? I've always been fascinated by medicine, by the human body, by the development of our anatomy, physiology, and everything. And those things fascinated me, but I'm like, what kind of doctor? What kind of doctors are out there? Well, I knew there were surgeons, there were general practitioners, there were various disciplines, and I went to the chiropractor in 1993 when I had my first major back injury, and I went to the chiropractors years before then, and I got to see the way they operate, and I was like, this is really fascinating. One of the biggest takeaways was at the medical office, you're waiting an hour to see the doctor for 3 minutes. At the chiropractor's office, you're waiting 3 minutes to spend more time with the chiropractor. It's kind of inverted. So I'm like, wow, this is way different, even before I knew what I knew today.
So how can I ask this? Do you, in your thought process, do you think your profession competes with like the medical profession of healthcare providers and physicians, or do you think it could complement?
In a word, I'm a team player.
Okay.
You see, because they do what they do what they do best. They do a good job. They take care of people that have been sometimes maimed in car accidents, or they put Humpty Dumpty back together again really well. But what I do is I work with my hands, because the word chiropractor means one that practices with their hands.
I didn't know that.
Yeah, the word chiro means hands, practor means practices with your hands. That's what hands on.
Okay.
So the other thing too is I've always loved fitness. Fitness is really my first love. I love going to the gym. I love working out. I love lifting weights. I like to stretch. I like to do stuff. I like to play sports. Played sports all my life, and chiropractic seemed to be a way to learn the discipline of medicine while maintaining that healthy lifestyle choices, like I told you about food, water, better lifestyle choices to make. Sports, being active, fitness lifestyle has been proven over and over again to be the best form of self-care, healthcare that you can be in.
How long have you been practicing?
13 years as a chiropractor.
And if you just, ballpark figure, right? 13 years, how many patients have you cared for?
Oh man, hundreds, thousands over then.
Now, if you could give a percentage, right? Now, it'd be good if I could ask them, but I don't have time to do 1,000 surveys. But in all truthfulness, if you could give a percentage, what percentage of those patients have gone on with their lives in relief?
I would say 95%, 90 to 95% of them.
What would be the 5% difference of why they,
Well, see, here's the thing. When in my profession, people have to be more proactive. They have to be involved in themselves, and some people don't want to make the necessary changes. Some people will say, "I don't want to do that exercise. I don't want to eat that. I don't want to do that," and they'll fail. They'll sabotage their own success.
So it has nothing to do with you.
Well, I try to, but sometimes the repair process can take longer than I thought, or there could be other underlying damage that is there that I want to explore a little bit further. That could take another type of my discipline, like emotional stress or something, and that takes a while sometimes to alleviate. And those people have stress that is undetected by conventional lab or X-rays or any kind of conventional means.
Well, if you could dig up one success story, what would that success story be? And then, what's the first name of that person?
Oh man, there is one story that I don't think will ever leave my head. And this happened about 20 years ago. I used to work at this gym in Broken Arrow, Oklahoma. And this lady came in one day. She was about 22 years old. And she came in with her shoulder down like this. This is what she literally looked like. Her shoulder was like this, just standing still, relaxing. And as I interviewed her and as I was trying to find out her fitness goals, she told me that a few years before that, she was pulled under a car and dragged 70 feet. It was a Mustang that her 16-year-old sister was driving. A freak accident that happened. She had multiple fractures in her hips, a lacerated lung. She had to have her gallbladder removed. She had 3 surgeries on her low back in the same place, and she had that frozen shoulder. She was going to physical therapy full time for about 1.5 years, 2 years. And then nothing seemed to help. No doctor visits, no physical therapy, no conventional exercise seemed to help because she had so much pain. Mm-hmm. But then I started working with her, and before my chiropractic training, just training with a few outfits that were helping me prepare for that phase in my career, in 4 months, she was able to, her shoulders came back almost level like this, and she was walking with more relaxed shoulders. She was moving better. I followed up with her about 12 years ago. I called her on the phone and I said, "Hey, how is everything?" She says, "I'm actually still in a pretty great deal of pain, but you are the only therapist doctor that ever helped. I've never got the level of help from anyone except you."
And that was before you even went into chiropractic?
That was before I got my advanced training, and advanced tools. So I learned a few advanced techniques in chiropractic school, and I learned more about how the body works and how to really help people on a higher level.
So who would be like your ideal niche clients?
Someone like her, or someone who has a lot of complications that.
But when you say complication, like, because I really want to break this down. Are you saying someone who's maybe been in some type of auto accident or some type of sports related accident? Like, break it down to us that way.
Okay, well, let's address auto accident first.
Okay.
Let's just pretend like I have somebody come in and they say, "My back hurts," or whatever. And I ask, "Okay, have you had any accidents?" And they say yes. And I say, "Okay, how many?" And when was the last one? I've had patients that have said, well, I've had 8 in the last 5 years.
Auto accidents?
Auto accidents.
Really?
And I'm like, were you injured? Yeah, seriously. And I would say, are you injured? And they would say, yeah, I was injured in like 4 of them or 5 of them. Not everybody's injured in all of them. But what they do is they start accumulating an unbelievable amount of stress that if they apply the slightest stress in the form of an exercise, it actually makes them worse because their nervous system has so much stored stress that adding stress to it actually makes their progress go backwards.
All right, so that's one ideal client. Who would be another ideal client?
Well, patients that have had emotional traumatic pasts. I worked with a patient, another one about 2 years ago.
Okay, emotional traumatic past, AKA?
Okay, about 2 years ago, I had this young lady come to my office whose father and husband died the same month of cancer.
So mental.
Yeah, she was in her mid-40s.
Okay.
And she was just like, I don't want to live anymore. I don't want to go on anymore. The pain is too much. She just wanted to go in her ex-husband's cabinet with the rest where his meds were.
So again, mental trauma.
Mental trauma.
Okay.
She had the mental trauma of her husband and her father dying the same month.
Right.
She came in 2 or 3 times a week religiously for a while because she was also dealing with some pain in her neck.
I can see that.
Yeah. And then I did some emotional release that was probably about a 5-minute release with her. And then about 3 months later, one day she turned around at the door, exiting the door to go do her exercises. She goes, Dr. Lopez, because of you, I don't want to kill myself anymore. I was like, what? And that's when she told me of the rest of her story. And I thought, whoa. And I realized more of my mission when I run into patients like this that have so much stress that conventional therapy seems to not be enough. Just taking a walk in the sunlight or doing diet modifications just doesn't seem to enough. It means their nervous system is not adapting at all.
Who would be another ideal? Who would be another ideal client?
Patients that have had surgeries, patients that have had multiple surgeries.
So like scar tissue.
Scar tissue, yeah. So what happens with scar tissue is 3 major things. Number one, the circulation is decreased locally in that area. Like let's just say somebody has had a C-section, a woman's had a C-section surgery or an abdominal surgery. They're going to have a lack of local circulation there. But they also lose a lot of electric flow, like nervous system flow to the connective tissue, the skin, the muscles around and everything. And the third thing is the connective tissue and the muscles, they lose their tensile strength. They're not as strong. So in other words, when they go to try to exercise their abdominals in the gym and they can't contract those muscles as strong as they used to, the muscles just won't engage. And so if they're released properly through the methodology that I've learned over the years in working with these type of patients, these muscles turn on instantaneously and they regain their strength. I have friends that are physical therapists and I've worked with them. I've showed them what I do and they're like, wow, yeah, we need to collaborate together after they see this because I don't do the stuff they do, but I say,
they don't do the stuff you do.
Well, let me make your job easier.
Right.
Let me make your job easier for your patient. Your patients will love you more.
Right.
What about personal trainers? Well, that's how I started. I was a personal trainer and then I started studying different outfits like corrective exercise, neuromuscular massage therapy, and then chiropractic. And then I learned that there are a lot of people in the gym that have those same pain or hiccups or anything that's holding them back from being able to activate certain muscles like I gave an example of. Let me give you an example. Recently, I had this lady who had a C-section scar for 16 years, and she was seeing a naturopath, but her naturopath did not pick it up. I picked it up, and I for the first visit, I picked it up and said, you have scar tissue there. Plus, she was breathing like this. Instead of breathing here, she was breathing through here, and she had chronic neck tension. And so what I did was I treated the scar, got that unlocked, and then I used a specific technique with neurologically based technique to wake up the nervous system and wake up the diaphragm.
A brain technique.
Right, a brain technique.
Okay.
And then it turned the diaphragm back on instantly, and she started breathing through here. Again, she inverted the breathing pattern because we breathe 25,000 times a day. So people can suffer from neck and head tension from just improper breathing.
So you mentioned surgeon, okay? So I want to go through these one profession at a time. So we're going to stay in the clinical, okay?
Yeah.
We're not going to go out of the clinical. We're going to stay in the clinical.
Okay.
You mentioned a surgeon. What type of surgeon?
Could be orthopedic surgeon,
Okay.
somebody who works on knees, shoulders, carpal tunnel, or
Orthopedic surgeon. Who else?
cosmetic surgeon.
Okay.
Somebody
Oh,
who's-
because of the scar. Well, no, it wouldn't be necessarily scar tissue.
well,
would it?
maybe the plastic surgeons, cosmetic surgeons that would breast reduction, breast augmentation,
okay.
those
Okay.
things too.
Okay.
Because that also, I've had to fix a lot of breathing with those type of patients too.
Okay.
Those type of patients have those same, because the scars near here where the diaphragm is, and it kind of inverts the pattern because it's painful to breathe here while the scar is fresh. So they have to, the body has to learn.
Overcompensate.
It has to overcompensate. So, but the body hasn't learned, okay, it's safe to breathe through here again. It's safe to breathe through here again. The brain's like, no, breathe through here. They're still
So
playing.
you're retraining.
Retrain it. Yeah.
Okay. So cosmetic surgeon. Give me one more profession in the surgeon field that you can work
Possibly dentistry. You know, people have
Really?
a TMJ and TMJ surgery.
with. My
and
wife had that.
They have sometimes facial, like a jaw that pops or clicks or something. And believe it or not, this may sound really extravagant, but there's sometimes patients that suffer low back pain because of a misaligned teeth. Like they'll chew on one side of their mouth, and it will activate certain muscles in the low back.
I can
and
see that.
It kind of goes almost under the radar with any conventional testing. So
Okay. What about people who are in the mental health space? What would that look like? I mean, would it be like a psychiatric nurse? Would it be like a mental health therapist? Like, who would that be?
yeah, so let's say we're talking about somebody who's trying to get over traumatic past, traumatic memories or something. And they're going through, they're a psychiatrist, psychologist, but they're going through the talk therapy. They're talking it out there, but for some reason they're still reliving that trauma. And what their nervous system has to do is it has to adapt. So here's the thing in a nutshell. Psychology is downstream from physiology. Now let me break that down just a little bit, okay? Every time we have a thought, there's going to be a response of one of two possibilities. Number one, our brain is either going to move towards because it perceives it to be safe or pleasurable, or it's going to cause a withdrawal response because the pain perceives it to be painful or dangerous. That's going to be when someone has a thought of, say you are going to an old family reunion, but you have a family member you and he or she have been button heads lately, right? And you haven't made amends, you haven't resolved anything. But seeing them would be painful, would be traumatic. Now, you get information that they're going to be there. You get this thought unresolved. You withdraw. You don't show up, right? And so when that thought is rewired, and I've had to do this so many times, I've had to help people go through painful divorces, painful breakups, painful loss. I mean, loss of people that they've, kids, parents, pets, whoever, they're still grieving, and they haven't successfully gotten past that grieving stage. And their nervous system simply isn't adapting. It's constantly saying, withdraw, get away from this, it's too painful. So if I decrease the tension that their nervous system is in, then the psychological treatments become much more successful after that. I hand them back to their psychologist, psychiatrist. I keep communication with them, and they're like, "Wow, man, we need to work together for the patient's sake with this." Because I don't sit with patients and counsel them. I don't do that, but they do. I'm like, I need your services as a counselor. I need you to be able to talk to these people.
Right.
You know how to navigate them through life like a life coach.
Right.
But when it comes to the stress their nervous system's going through, that's what I'm good at. I can give them back to you, and they're so much more apt to move forward with whatever goal they have, because a lot of the fear is gone, the worry, the whatever emotion they're dealing with that's stopping them on their tracks, that's causing that withdrawal.
Licensed massage therapists, how could you all complement each other?
Licensed massage therapists work primarily on muscles. And as a chiropractor, we are trained to work on joints as well as muscles. The joints tell the muscles what to do. So a lot of times, like, for example, if you have a knee injury, a shoulder injury or something, the muscles around it tighten, right? To protect the joint from further injury. And it's one thing to have the muscles worked on, but really when I've started working on the joints, it really unfolded a new reality of like, wow, look at this. People are getting better in less time. But there was a study done in 2001 at Henry Ford Hospital with one of my mentors. he went over there and he was working on people that had intractable migraines. In other words, these people had migraines for 30 years, or one person had migraines for 8 years straight. There was a group of 60. They put one group of 30 getting Swedish massage, the Swedish relaxation massage, and they had the other 30 going with this particular group that I was trained under, and this was the results. The Swedish massage group in the beginning had no results, no relief of migraines. The other group, what are called the St. John group, the guy I trained under, got 45% relief of this. But what happened was, after a few months, they switched. Now, the Swedish massage came over to the St. John group, and what happened was the Swedish massage group doubled in their results to 90%.
Oh, because they brought on another skill.
Well, what happened was these Swedish massage patients got so relaxed from the Swedish massage that the St. John treatments that were more precise, because the nervous system was so relaxed that their body just was like, it was able to open up. So I need the Swedish massage guys because I don't do those type of massages.
Right.
But I need you because if you're good at it, great, do that. Hot stone, all the spa stuff. People need that kind of stuff. I think it's a very underrated profession. I think it needs to be more given the spotlight a lot more. Let me explain to you the tension scale that I like to go by.
Okay.
Let's just pretend like your body, your nervous system can handle. I'm going to give a metric of pounds, okay? Because we're all can identify with pounds.
Right.
Let's just pretend like 200 pounds is your limit. That's everybody has a breaking point.
Right.
There's only so much stress you can handle. There's only so much weight you can lift. There's only so much emotional stress you can. Last night my son and I were watching Jaws, and I don't know if you remember the scene in the movie where the young boy, the policeman's son, was swimming in that lagoon-looking place where the shark attacked that other guy, but he was in shock. He fainted. And that's what happens when the nervous system's tension exceeds its limit. It shuts down. That's what caused the shock. It caused his nervous system to momentarily shut down. And so if a person is getting, so here's how I like to put it. This is how I like to explain it to my patients. If 200 pounds is the tension limit, and let's just say 150 pounds produces symptoms. Okay, that could be pain, it could be anger, it could be anxiety, it could be depression, it could be any of those things. Those are symptoms that need medical care. Okay. Now let's just say if I've taken a health history on somebody and I discover through their health history that, let's just say they're at 100 pounds of stress. Okay. That's the level that they're at rest. And let's just say they have a job where they're doing physical labor, right? They could be working at a warehouse, they could have a blue collar job, and their back kind of is occasionally stiff, and they wake up progressively stiffer every morning. What it means is they're moving very slowly, very close to the symptom range, and then eventually to the breaking point where, you ever heard the saying, the straw that broke the camel's back? Yeah. I don't believe that straws break anybody's back, but I believe a camel that has accumulated enough tension to the point where all it takes is the very weak stress of a straw to break their back. Then they succumb to their illness or disease. So here's the difference. What if I used my tools and techniques to help their nervous system tension go like this? Goes down. Now, what if they come in for a few visits and their nervous system tension is down at 50 instead of 100? Now what happens in life when they encounter 50 pounds of stress at 50? They are now at 100. What happens when they encounter that same 50 pounds when they're 100 pounds at rest? Symptoms, 150. So in a nutshell, there's no known measurement for this yet. Just like if we were having the same discussion, you and I, back in 200 years ago about blood pressure. Blood pressure, everybody knows blood pressure, but it was only starting to be measured in the late 1800s. But humans have had blood pressure all of our existence. We just didn't know how to measure it. So right now, I don't know a way to measure this resting tension in the nervous system, but I guarantee you this. Most people that are watching this understand. They're like, yeah, that makes sense. Yes. Now, when I introduce a stressor into my life, depending on where I am on that scale, it's going to affect me different. Here's an idea. Not everybody gets sick during cold and flu season, right? Right. Some people can go out in the flu and be exposed to the flu or cold, and they don't get sick. Some people.
Is that because they're not getting sick because they took the flu shot, or it could be a combination of either or?
Well, there could be a combination of that they probably have a more resilient nervous system. Okay. A stronger nervous system. Let's just say they are let's just say they're down here. They work outdoors. They have something about them, but let's just say somebody else who's closer to their breaking point encounters the same sickness in the air,
Mm-hmm.
then they could end up in the hospital. That happens. People with pneumonia, people with pneumonia is an airborne illness. It comes in through your airway. Same thing with a common cold. It happens that way. So, but not everybody gets sick during that time is what I'm trying to say. Some people can get sick drinking milk or having dairy products or eating gluten, all those things. Why? They have accumulated, they've eaten it too much. They've repetitively stressed their nervous system out to the point where their nervous system's like this.
So let's take someone who has completed their chiropractic treatment, right? What should they do in order to maintain?
Oh, the one of the best ways, I like to call my personal trainer buddies and say, work with this patient right here to keep them in shape. Give them basic exercises. You handle them. You do what you do with that.
Okay, so that's where someone that's a personal trainer would be a good collaboration.
Personal training, that is a very valuable asset to the completion of their health. Absolutely, yes.
So let's take someone who has been. Okay, let's talk about pain medicine, right? Pain medicine can do one or two things, or it can do both. One, it can help alleviate the pain.
Right.
Two, it can help alleviate the pain, and now you have an addiction. Or three, it can do both.
Yeah.
What do you say to that type of person who, they're taking pain medication for maybe it's, back pain, leg pain, knee pain, and possibly what could help with the situation is, chiropractic care. But they've been so dependent on pain medication.
Right.
What do you say to that person that says, you know what, dang, Kevin, I'm that person because, I'm only taking the pain medication because I have became addictive. It has not. It sometimes alleviate my pain, but now I'm addicted to it. What do you say to that person?
Okay, so I could probably help make sense of why the brain is now dependent on that.
Okay.
So you remember the tension scale? Perhaps the medication is the only thing that has been a reliable source to get that tension to a manageable level. That's the first point. The second point is addictions, and you can read works by Gary Wilson or by anybody who is an addiction recovery therapist would tell you that the way the reward circuitry in the brain works is when your circuitry starts to dip down and you start feeling low and you need kind of a pick-me-up, then the drugs they're taking could be the only thing that their nervous system registers as a reliable way of relief, a reliable way of alleviation from this great pain. And they just don't see any other way. This is why people could become alcoholics or people could become addicted to the medications that they're on, is because now remember, this is not something that's logical, it's not something that's cognitive, it's pure sensory. And what I mean is their brain has now dipped down like this, and they now like hear this, like, take this drug or drink this or whatever, and now they experience that pick me up. So the brain learns through feeling, through this feedback loop, that it is getting this relief through this route. It hasn't learned any other effective route yet. So if you tell somebody, why can't you just quit drinking? Why can't you just quit smoking? Because it's not cognitive. It's not something that you could just walk away from cold turkey. It's entirely physiologic. Psychology is downstream from physiology. So you got to go a higher level and fix the physiology. And there's several components to fix with that too. One of them is an understanding of the tension scale. That's why I go to great length. Like some people can be athletic in their young years and maybe skip a decade or 2 decades or 20 years of exercise, and they get older and they're like, I'd like to go back in the gym, and that muscle memory is still there. They still remember let's just say they went to they played sports. Like when I was in grade school, our gym teachers made us run. They made us do push-ups. I remember
the bear crawls.
Yeah, they made us do sit-ups. I mean, it was practically military training. When I went to school, we climbed ropes. We did monkey bars. And then, of course, as an older adult, I remember that because the memory's still there. But let's just say somebody grew up and they didn't do all that, and they got to create new memories, and they're my age. Yeah, they got some work to do. They got the work cut out for them. And there's people that put inspiring stories online about how they did yoga or they did certain exercises and they dropped weight. It took them a couple of years. Hey, man, kudos to them. That's great.
Do you think people view your profession more as a luxury and not something that's necessary?
Possibly, but I think the general awareness in public, especially about back pain, neck pain, headaches, is like, especially with medical doctors, they'll say, look, you need to go to a chiropractor. We're starting to get a little bit more respect from that, respect that's due us after so many years of kind of having to prove ourselves, and that's fine. So when patients see that, they're like, well, you'd be better off going to your chiropractor. You got low back pain or something. And if there's no surgery that could touch it, 19 years ago, I had my second major back injury, and my younger brother is an anesthesiologist. And I called him on the phone one day and I said, what surgery could fix this? And he said, don't get surgery. They're 80% unsuccessful. And I said, well, what do I do? So I had to go visit some colleagues of mine in Florida, and they showed me that pain was coming from my left hip. And they worked the muscles out in my left hip, and I came back and I started doing self-traction in my low back at the gym. I'd strap a belt to my back, and I would let the machine pull my back, and that's how I got out of pain with that particular incident. But yeah, patients are going to have that complaint at their doc because people have headaches and pain all the time in their back. They're either going to go the medication route, but there are some people that are like, I don't want the medications. I don't like the side effects. There's going to be some people that are going to be okay with it, but there's going to be some people like, I don't want this. Is there another way?
So this is where I want you to look at your camera, which would be the one that's in front of you to my right. Mm-hmm. For the person who has never, ever considered chiropractic care, I want you to speak to that person as to why they should consider it.
Okay. If you have tried everything and still have not resolved the pain in your body, we're the one that you call. We're the team that you call. If you have this emotional stress that have not been completely successfully adapted, your nervous system hasn't adapted to, we are the team that you call. If you have this fitness goal that you're trying to reach and these muscles just won't turn on or they just won't activate for some reason, some unforeseen reason, we are the team that you call. That's pretty much it with that. And in those areas, that's just the basics.
So, Doc, not every guest get this, but I just think you gave so much wisdom, so much knowledge. And so what we want to do on behalf of Legacy HealthWorks, I'm going to give you not one, but two autographed copies of the book. The first book is called Unlocking Opportunities. It's the ultimate guide to exceeding at networking events and crafting the perfect elevator pitch. It seems like you do a lot of networking. You do a lot of referral connections and things of that nature. And so we want to get this first book to you.
Excellent.
The second book is in your profession. It's called Clarity in Care.
Yeah.
How clear communication builds trust, improves outcomes, and strengthens patients' relationships. And so this is your second book.
Excellent. Thank you. Thank you very much.
Yeah.